Hello, my name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. You've seen me do these updates now for the past few months in conjunction with the leadership of the ACOI. And I hope these messages are helping you to keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI. See, I live in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. And as we are facing this once-in-a-lifetime global battle, I want to hear from you, my colleagues, who are experiencing the fight from their locations, no matter where you are in the country. And I provide my contact information at the end of each update, so listen for that. I hope you take me up on this invitation to reach out. Moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we're seeing as well. Also, for more information on the ACOI's really awesome new peer-to-peer well-being check-in sessions, these are also available free of charge to ACOI members. Please go to acoi.org/COVID-19 and check on the box so you can find out how you can join in. These Zoom sessions are really an awesome way to help feel connected and support during this very challenging time. So we are doing one story today. It's a little bit of a longer story, and it's called Improving Our COVID Response. And there's no question that, that the response that we have had from a federal perspective has been less than stellar, and I have been calling out on this vlog on the importance of a centralized and coordinated response. And so this was a really wonderful article that came out in STAT that really looked at and spoke to 11 different epidemiologists and infectious disease doctors to see how we can do better in the future. So here we go. So I think all of us, especially those of us in medicine, would agree that the response to COVID-19 pandemic has been terribly uncoordinated and inadequate. And I think about future waves of the pandemic, and I don't think about it just because we are seeing regional outbreaks and spikes in the US right now, but I think about it because we simply must do better and be prepared for when the next national wave hits. So this recent article in Stat News encapsulated some of the great thoughts, and I wanted to share some of them with you here. So we now know the virus began circulating in the U.S. between January 18th and February 9th, meaning that sustained community transmission began even before detection of the very first cases. So for the next time, prioritizing early warning signs and paying attention to early warning signs is necessary. The test, trace, and isolate process of testing symptomatic people and then finding their contacts to then also test and to test and isolate them if needed, it is a good idea, but we do need to be proactive with better ways to determine where infection outbreaks are before waiting for people to become symptomatic. So one answer to this is, believe it or not, lies in wastewater. So there are now hundreds of U.S. utilities that are running tests on wastewater to determine if there are cases in a given community. By identifying the virus in the wastewater, communities benefit with a heads up about a week or so in advance before people start getting sick. So wastewater surveillance is becoming an early warning tool, and I think that's, it's a great way of thinking about things. We're doing that here in New Orleans. I actually reported on this story earlier, and I reported on it as poop predicts pandemics, but one of my students came up with fecal forecasting. And yes, I did actually make a poop joke there, actually. So, speaking of being proactive, we need to start responding when numbers appear small. We all know that exponential rise in numbers happen fast, and it makes it very difficult to contact trace. That's why clear, sustained trending is important to stay on top of. And I especially love what an expert at Johns Hopkins said recently, and that is, with a respiratory virus that's often asymptomatic, you know that whatever number of cases you think you have is not the number you really have. It's really only the tip of the iceberg, and boy, is that the case here. So I interpret this as that we need to take every case seriously and needs to be taken as seriously as possible. Also, if numbers are going up, institute restrictions sooner. And New Zealand is a perfect example of doing it right. New Zealand implemented travel restrictions February 3rd, despite having no known cases, and it closed schools around the same time. And the lockdown followed soon after. Now their cases are down to 0. We also need to pay particular attention to addressing the outbreak in minority and high poverty communities. Even the idea of a drive-in testing center leads toward more affluent members of society just by the mere fact that you need a car and that you need a car in the first place to access those testing centers, which essentially attests to the inequity of testing availability. The truth is, many of the people who don't have access to a car are frontline workers who also don't have the capacity of social distancing. So therefore, they are naturally more susceptible to the SARS-CoV-2 virus, which of course creates a vicious cycle. Another tool being discussed are contact tracing apps, and those of course require a cell phone that is working, another item low-income people may not have access to. Now, let's also talk about one of my favorite topics, which are masks. So another potential obstacle for low-income individuals is the availability and cost of masks. They should be provided free by the government instead of having people to fend for themselves. During this pandemic, the CDC information was very confusing. First, the information provided proclaimed that masks don't help. Next, people were discouraged from actually buying masks since they were in short supply. Even worse, some businesses, including healthcare facilities, were actually prohibiting employees from wearing masks so that they didn't give the wrong impression or scare customers and patients. Now masks are being advised for everyone to curb the transmission of the virus. As a result, people don't know what to believe, and they are not likely to trust official sources of information going forward, which is really quite sad. And unfortunately, in many areas of the country, we are not seeing adherence to the advice to wear masks, and that's also a dangerous trend in this epidemic. Now, a mathematical model of COVID-19 transmission suggested that hand hygiene and near universal wearing of face masks can achieve approximately a 60% reduction in contacts needed to defeat the pandemic. So understanding what kind of social distancing works best can provide us with better information to inform the public for an upcoming wave. Does shutting schools help more than shutting down places of business? Being strategic in how we shut down can also help us not only be more effective, but also help us with economic impacts. And Japan is actually a great example of how they controlled the outbreak while being diligent on the use of masks and other measures, such as bowing and not shaking hands. The other issue that needs addressing for future waves is our national stockpiles of supplies. In recent years, this stockpile diminished, and by the beginning of April in the U.S., we were at about 90% depleted of protective equipment, of PPE, forcing everyone to really fend for themselves. Also, speaking of fending for themselves, people who test positive need to be provided with isolation strategies to help them successfully isolate and not infect others. And this information and other support is sorely lacking. Lastly, we need to communicate better and realize that we can't declare early victories if and when we see numbers going down. That's dangerous thinking. Life isn't going to be how it used to be for a very, very long time. So keeping up our guard, having proactive strategies in place, and being sensitive to the needs of all of us, regardless of income level, and the ability to safely social distance is really the best way to stay on the offensive here. So I thought this was a great article from STAT. It really kind of outlines some very key and critical parameters and strategies for us moving forward in the future. So please stay on the lookout for these regular updates, and to read more from the sources used in this report, you can go to the acoi.org/COVID-19 website. Together with the ACOI, we will help you have the latest information to help you respond to your patients and also stay on top of the crisis. Also, please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.